So I'm Professor Constantine. I am a haematologist that work at Peter MacCallum and St Vincent's Hospital in Melbourne, and I have a special interest in B-cell non-Hodgkin's lymphoma, which includes mantle cell lymphoma. So although the majority of mantle cell lymphoma patients present with disease that are progressing, that grow moderately quickly and therefore requires treatment, there is a subset of patients that present with diseases that can take a long time to grow and may not require treatment for many years and may not require treatment at all. So the first thing that we do is obviously go through all the tests to try and determine how aggressive the lymphoma is, how much of it is in your body, and where it's located. But then there are some patients where the lymphoma seems to be behaving in a very, what we call indolent, in other words, a very slow growing manner. And for those patients, we will sometimes elect to watch and wait until the lymphoma progresses to cause problems. I have to emphasize that this is only a minority of patients. The majority will present with lymphoma that has been growing moderately quickly, so they will often describe that the lymph glands are getting bigger over a matter of several months, and those patients would typically require treatment. Now, treatment of mantle cell lymphoma depends on the age and the fitness of the patient. So for patients who are young enough and fit enough to undergo a procedure called a stem cell transplant from their own patient, or autologous stem cell transplant, the intent of treatment is to give chemotherapy, which is fairly intensive, to try and reduce lymphoma to a very small amount, and then to give a stem cell transplant to essentially try and get rid of as many lymphoma cells as possible. Many patients after this type of procedure will enter into a deep remission where we cannot find any evidence of disease, and they may remain in this remission state for 10 years or more, sometimes before the disease will come back. But we do not think that we've actually cured any patients, and the intent of the stem cell transplant is to give patients a very long and good quality of life remission away from hospital and away from doctors. For patients who are not fit for a stem cell transplant, because it's quite an intensive procedure, we then rely on chemotherapy, and sometimes after chemotherapy we will give an antibody called rituximab, which is an antibody engineered to attack cancer every 2 to 3 months to try and maintain and suppress the lymphoma in response. Those patients do very well, but obviously if they have not undergone a stem cell transplant, the remissions will not be expected to last quite as long. So we're talking about expectations of 3 to 5 years of remission on average before we need to retreat the patient again.